Good afternoon, everyone, and thanks for taking your time to come out today. Sorry it's a bit later in the day. There was a lot of schedules we needed to respect. I felt it was important to have this event to clearly articulate my real position on the hospital once and for all. Last week, we heard from my opponent, who continues to use the need for a new hospital as a political football. He's used it now in every election, at every level. He continues to spout mistruths and misinformation at a scale that really needed to be corrected. We all know the process that led us here today. It's been one of the most intense and in-depth debates and public discussions we've had municipally in our history. Unfortunately, my opponent has been part of the side that has made this a very divisive and contentious issue in our community, and apparently continues to do so. The need for a new hospital is not, nor will it be, up for debate. It is completely agreed upon. The discussions that surrounded the location and the process in which the site was chosen did not need to pit residents against each other. My opponent seems to thrive off division and will use it as a political tool at any time where he stands to benefit. That's unacceptable. That's not leadership. My position on the site selection process and the location has been clear, and the reasons I've articulated in voting against this site still exist today as unaddressed issues that need to be dealt with as a community. But as I have done on my 2 terms of council, I will and I do respect the direction and the will of the people. Just as recently as 3 months ago, we had a provincial election where area residents supported MPPs who ran on delivering this hospital and making it a reality in this location. City Council has already approved the zoning change and the creation of a tax levy collecting our share of the municipal portion. I am here today to pledge to the residents of Windsor that I will not hold up or stand in the way of that funding being allocated to this project when needed. Contrary to my opponent, who called this the perfect location just last week, I know, as do tens of thousands of residents, this was not the perfect location. Far from it. I, unlike my opponent, will not hide my head in the sand and pretend that there are no issues tied to that decision. I am prepared for the work that needs to happen to make this hospital not only a reality, but a success. The main issues that we need to address as a community are as follows. 24-hour ER and full services at the Holt campus of Windsor Regional Hospital starting from day 1. Equity and access to health care for those who need it most has been one of the most egregious oversights of this plan as it stands today. I am glad my opponent has finally pledged support for 24/7 ER services in the core. Remember, just 3 months ago, he mocked and called out provincial candidates who did the same thing. Along with Councillors Bordelin, Costante, Kaschak, and McKenzie, I have been steadfast in advocating for 24/7 ER services in the core. This shows that our work has not only paid off, but has led the way in making sure Windsor residents get the services we deserve. Don't we deserve that kind of leadership in the Mayor's office? The second issue that needs attention is the expense and timing of the infrastructure needs in the surrounding area of the new hospital. Sandwich South is a blank slate with no infrastructure to handle such a huge investment, along with the ancillary investments that will follow. During this time, the city will also begin developing the Sandwich South lands for housing. What will all this new infrastructure cost? We actually have no idea. Back in September of 2021, I tabled a motion to have a third-party consultant report back with a comprehensive outline of the costs and timelines of needed infrastructure work in the area of the new acute care hospital. That motion did not pass, with my opponent being the deciding vote against. He and the other 5 councillors you saw flanking him in his campaign office last week all chose to disregard this concern and willfully ignore the true cost to Windsor taxpayers. Will City Council collect much-needed development charges from the province for this hospital? Will the province or county contribute their fair share to the immediate infrastructure needs to make this regional hospital a success? Will there be a huge shift in capital priorities to ensure that we keep pace with these investments without cutting much-needed road and sewer investments? We simply do not know. Why would we not want to know the full impact of this investment and properly prepare for it? My opponent was a deciding vote against knowing all that. How much does that one vote cost us? Today I wanted to set the record straight so the citizens of Windsor have a clear understanding of my position directly from me. Not only will I not stand in the way of using our municipal levy to contribute to the hospital when called upon, I will strengthen the plan with the following, starting immediately if elected. Number one, create a community-wide health services table exploring not only 24/7 ER access in the core, but many other services that will be important to the communities who need them most, with an emphasis on mental health and addictions. Agencies such as the Canadian Mental Health Association, Hotel Dieu Grace Hospital, and the United Way will all be asked to contribute to this important conversation. Number two, establish a Sandwich South Infrastructure Task Force comprised of residents, industry partners, city administration, and infrastructure engineers. The goal of this task force is to determine and cost out the infrastructure needs of the area as we begin construction of the new hospital in the greater context of the overall Sandwich South development. Number three, prioritize nurse recruitment, working with Invest Windsor Essex, Workforce Windsor Essex, St. Clair College, and the University of Windsor. This program will partner with Windsor Regional Hospital in continuing their efforts to attract talent to the Windsor area. We are in desperate need of nurses in this community. Number four, become a leader in advocating for investments in the mental health, addictions, and long-term care sectors. Hotel Dieu Grace Hospital has space and infrastructure to open up more mental health beds immediately. Hotel Dieu Grace Hospital also has the capacity to create much-needed long-term care beds. We know that they are actively looking for space to invest and expand into this sector, and as a city, we need to support their bid and advocate on their behalf. We need to advocate for funding now. We currently have no formalized advocacy arm in the province working on mental health and addictions issues specifically, not at the Association of Municipalities of Ontario or any other formal municipal body. I pledge to lead this initiative across the province. Locally, I will begin by adding 8 new outreach and mental health workers to our streets to work with police and mental health agencies for improved access to service. While we have pledged support for the H4 Centre, we cannot wait 5+ years to begin work on this issue. Number 5, prioritize all transit Windsor routes that will access the new acute care hospital. Routes will begin before the doors open as construction workers and others in the area will need access to as the project moves ahead. I will also work to create a special compassionate fare for family caregivers who will need to be at their family's side for days at a time at the new facility. And finally, number 6, expedite the creation of a climate action and energy plan for the Sandwich South area. Our existing climate and energy plans do not include this area. This plan will include consultations with members of the public, local institutions, industry experts, researchers, and our own administration. As we develop and move ahead with the clearing of green space and creating more housing and services in Sandwich South, we need to do so with our climate goals in mind. City Council has already endorsed a motion to create carbon-neutral neighborhoods in Sandwich South. We need to ensure development here is done properly. Health outcomes are tied in so many ways to our climate goals and actions. We cannot ignore those here. So, to summarize, my opponent continues to spread misinformation and fear and wants to use the need for a new hospital as a political football for him to punt around. By contrast, I am committing to you clearly that I will not stand in the way of the provincial plan to build a new hospital. I will work with the province and the county to fulfill our financial obligations to this project. But I am not stopping there. I am pledging to the residents of Windsor that they deserve to know the full cost of this investment, financially and environmentally. I have a 6-point plan to address the gaps and prioritize the entire health and well-being of our community. I have always approached decisions at Council with integrity and consistency. Residents of Windsor know that if I am here now making a pledge, I will keep that promise and work with the province to make this not only a reality, but a success. We need to approach this project with eyes wide open. This will be a generational investment that will need a proportional municipal investment to accommodate it here. We cannot hide our heads in the sand like my opponent continues to do, and we cannot continue to politicize a project that needs to move forward and open its doors to the residents of Windsor, Essex as soon as possible. Thank you all so much for coming. I'll take questions now.